Hey, it's Dr. Dunaway here with Chiro Strength, and I'm going to discuss today a really good movement snack to desensitize neck pain. And when you're talking about desensitizing neck pain, you got to broaden the scope and look at what's going on in the shoulders, the lats, and what's going on in the deep neck flexors here. Not worry too much about releasing and getting the upper traps loosened up, because that's typically what we find. The neck is super susceptible to aches, pain, strains, degeneration, because we got this kind of unstable melon here, like a golf ball on a golf tee. And to make matters worse, we sit in a posture that allows this guy to kind of roll off the shoulders, and now we have all these muscles back here trying to pull it back. And aside from that, if we have instability here of the shoulder girdle, those muscles will lock down further to help stabilize this and to keep this from falling off our shoulders. So the upper traps, the levator scaps, are chronically tight, and instead of stretching, try this drill right here. You're going to be face down, palms are going to be down in the ground, and I'm going to kind of jam my forehead into my hands, and as I do that, I'm going to activate the deep neck flexors. So as I do that, my chin retracts, and I'm going to keep my tongue on the roof of my mouth, breathe through my nose, and as I retract that chin, I'm going to kind of come up and pull myself up through the upper thoracic spine. Now at the same time as I'm doing that, I'm going to get a little activation of the core by giving that little cough, and make sure I have good belly breathing patterns. And as I get up, as I'm coming up in this position, I'm putting my arm through the ground, through the full forearm and the whole hand, pushing through the ground and kind of giving myself a little pull forward, and that will activate the lats and the serratus anterior, which will be good scapular depression to keep the shoulders out of my ears like this. And at that chin retraction, here's what it looks like all put together. And then back down for a 5 or 10 second hold. And again, we're practicing getting really good at being stable in a low threshold environment. Allow all these stability muscles to hold that posture, and don't rely on a lot of these prime movers or big powerful muscles to hold that posture. So as far as the core engagement, step 1, the engagement of the deep neck flexors by pushing down, step 2, and then pushing through the ground to activate everything right here as you push back, using the upper thoracic spine to kind of pull yourself back. Hold that posture for 5 to 10 seconds and accumulate 1 minute of doing this. Now again, this resets what you feel like is normal posture, and so you can make these minor adjustments throughout the day. There's no one good posture for everybody. There's no one good posture for anybody, really, if you're talking about sitting still, because we're meant to move. But having an idea what that baseline feels like and resetting that baseline a couple times throughout the day will take a lot of stress off this neck. And then if you want to go get massage, chiropractic, anything like that, any treatments you do to this area will have much better effects if the surrounding areas are addressed as well. And so if you have any questions, please leave some comments below. You can always reach me at drdunaway@chirostrength.com. But again, this is Dr. Dunaway saying, don't just mend, transcend. Thanks, guys.